Well, a very warm welcome back to this final session of the third and final COVID Partnerships Conference organised by FET with our wonderful partners across the world, as you can see in the acknowledgements. Um, I am absolutely thrilled with how today's gone, but it's been a very sobering day in other ways. We've just been talking about the challenges that health partnerships have risen to face over the last 2 years. Hello, I thought I'd started and then something happened. So I'm going to start again at the risk of boring people. Sorry about that. So thank you for bearing with us. And this is the final session of the COVID Partnerships Conference. It's the final session of the third conference, the final conference entitled COVID Partnerships. We've been reflecting on how health partnerships have risen to the enormous challenges of COVID over the last 2 years. But it hasn't just been COVID, it has also been coup, and it has been cuts to UK aid and other countries' aid. So we have been faced with an immeasurable number of challenges over the last 2 years. And I think we have remained buoyant, as we've heard during the conference today. But it feels very logical for us at FET to give the final keynote speech slot to Professor Zhao Zhou, who is a distinguished orthopedic surgeon, who is the former rector of University Medicine One, where I've met you on at least two occasions, most recently in January 2020. Myanmar is very close to our hearts. We've had very strong ties with the people of Burma, of Myanmar, for many, many decades. And when I met Professor Zhao in January 2020, we were planning to spend lots of money in lots of very interesting ways. COVID happened. It didn't stop us. We carried on planning. And then the coup happened and it stopped everything. And all the progress that we had, and all the momentum we had in terms of our planning, came to an abrupt end because of the intervention of the military. It's bad for the health of the people of Myanmar, and it's bad for healthcare workers who we support. And therefore, it's a pleasure to give the stage to Professor Zhao Zhou, who is the Minister of Health in the National Unity Government. Professor, the floor is yours. And after you've finished, I'll make some concluding remarks, and then the conference will come to a close. Thank you for joining us, Professor.
Thank you. Thank you very much, Ben. Thank you very much. Good afternoon, ladies and gentlemen. Thank you so much again for inviting me to deliver the closing plenary remarks at this third and final COVID Partnership Conference with the objectives of the Training Partnerships for Improvement approach. Everyone on our planet has been affected and challenged by the pandemic. I would like to congratulate you all for maintaining the ties of solidarity across border during this incredibly testing period of pandemic. When death tolls were soaring, when emergency departments were overflowing, when many health workers were killed in each country instead of responding in silo. The world has stood up in solidarity, using technology and science together against this pandemic, which has brought us to this moment. I would also like to congratulate all countries which have been able to accomplish full coverage of COVID-19 vaccination. As yet, COVID-19 remains rampant in the war around us, still around us, with more than 900,000 new cases yesterday alone, 507 million cases across the world, and 6.2 million dead so far. COVID-19 has not gone away yet. We must, as this conference has demonstrated, find ways to live with it. And we have, from the example of nurses in Pakistan to doctors in Ethiopia, the war has responded and essentially services are being provided. I believe this is not the case for Myanmar. People of Myanmar sadly have been suffering under an unlawful military coup since February last year. After successfully managing first and second COVID waves with vaccines waiting ready for distribution under the leadership of democratically elected government and the people of Myanmar. The healthcare, education, economic system of the country of Myanmar has been collapsing under the military junta and military council. And people like me, healthcare workers who resist the military, have been brutally targeted. I was forced to leave my house. They burned my house, my office. I have to leave my office and my hospital. But I am lucky enough to be speaking today and working in displaced IDP camp, including my medical students. 36 healthcare providers has been killed by inhumane, brutal military junta after the coup. More than 450 attacks had been carried out by the military and prevented us from treating and taking care of the patients. More than 800,000 people are internally displaced and requiring humanitarian assistance. During third COVID wave in last July, oxygen cylinders, medicine were seized by military forces, leading to hundreds of avoidable deaths. We remain in the midst of the coup, of the COVID-19, and in crisis. Despite these phenomenal challenges, we, medical personnel, in the new National Unity Government of Myanmar, together with ethnic health organizations, we are united. We are united to fight the COVID-19, and we are united to fight the military junta. We formed COVID-19 task force and providing services online and on ground. In some area are underground. We are hiding and taking care of the patient, even risking our life, using telehealth clinics, 24-hour telegram channels, as well as by establishing the 167 mobile clinic across the country. These services are made possible by the strong determination of healthcare workers on the ground, even risking their lives. Myanmar medical diaspora around the world and the international community, like TED, standing strong with us during this very difficult time. On a national scale, what we are providing is far, far behind, far, far from the meeting the demand of the country, demand of the people. the public engagement with military-run COVID-19 vaccination program is weak due to the mistrust of the military. People, they mistrust the military. And ethnic area have not received any vaccine from the international community due to military junta causing the breakdown of negotiation. Our policy, NUG policy, is people first, transparency and equivalence communication among the parties, and involvement of the independent third and fourth party in the negotiation, delivery, and monitoring process of vaccine acquisition. But the military junta did not comply. They used COVID-19 as a weapon to kill the people of Myanmar and vaccine delivery as a tool to manipulate the politics in Myanmar. UN Secretary General Antonio Guterres called for a global ceasefire, though a few short-term ceasefires were declared in March and April 2020. They largely failed to produce a meaningful decline in level of violence. As global experts have noted, the pandemic had simply made things worse for population already struggling under the burden of conflicts. The similar scale of impact of conflicts are unfortunately seen in Yemen, Syria, Afghanistan, Ethiopia, and Ukraine. Armed conflicts can have tremendous negative effect on human security and health governance. It is therefore of crucial importance to monitor the impact of COVID-19 on armed conflicts, risks, and to develop adequate policy responses, such as sanctioning perpetrators trying to exploit the pandemic. All dictators or autocrats act in similar way, having and using only weapons, making people fear, and we as a medical profession have risen, and we need to continue to rise unanimously and in solidarity against all dictatorship and autocracy, causing instability, unstable, pain, and suffering in the world. Going forward, Dr. Tedros' call of peace and stability are essential ingredient to better quality healthcare. Without it, people will continue to die. Although much has been discussed, the international systems are still very weak to enforce peace and to make perpetrators accountable for their actions. The UN, the WHO, the international community must do more. We must stand together. My key requests from all participants are to stay connected and engaged with our revolution against the unlawful military, unlawful dictator in Myanmar and in the world. The world will no doubt face major challenges in the future, and unity and solidarity are the way forward to recover. Using these tools, I urge we work together to build better, more robust, and sustainable systems to withstand for conflicts and pandemic in the world. We have to be united. We have to fight our common enemies like COVID-19 pandemic, our common enemies like dictatorship, our common enemies like autocracy, our medical personnel, our healthcare provider, with a strong partnership and solidarity of us, we will prevail any conflicts and pandemic in the world. Thank you very much for your attention. Thank you.
Thank you so much, Professor. And as the world is diverted in its attention to focus more on Ukraine, it's been a pleasure to be able to express the solidarity we feel for you and the admiration we feel for you in Myanmar. And thank you very much for those insights into the challenges that coup have presented and COVID has presented to the health of the Burmese people and to health workers in particular. And thank you for ending this conference with that note of urgency. Our work is not done. In some ways, the conference has been a sobering reminder of the challenges that we face. I was very moved by the conversation at Hargeisa Hospital, the Somaliland colleagues who spoke earlier. Every one of them was incredibly open with their lived experience, but every one of them has lost someone they love to COVID. Everyone is deeply impacted personally as well as professionally. And I think I want to acknowledge that sometimes we organize these conferences and invite people such as yourself, Professor, to speak, but we need to be aware of how much we're asking of you, how important, how personal this is, how affected you are and the lives of your loved ones are. So thank you for your time. This conference has been full of those sobering reminders of the challenges we face, whether that be inequality of access to vaccines, whether that be an agenda around decolonization and shifting of power that we need to achieve if we're to achieve equitable relationships. But it has been, I hope you agree, and if we were together in a room, I think I'd be able to look you in the eyes and check, but I can't because I can't see you. But I think it has also been uplifting. Um, Jo gave a phrase earlier. She talked about that sense of global belonging, and there is something about the power of solidarity, isn't there? The power of the value of communicating globally, the power of knowing that as we work locally, we are being thought about elsewhere, and thought of globally. And so I have really enjoyed the reaffirmation of the value of that global solidarity. I think I want to drop the phrase global health. I think that's one of the conclusions I come out of the conference with. I've been wanting to do it for a long time, but global health has too much the connotations of a kind of elite club that some people belong to, some don't, and you have to have a fancy airplane ticket and you have to have a, I don't know, a fancy job title perhaps in order to be employed in global health. The fact is all health is global. I think Navina Evans made that point right at the beginning, and several people have made it during the day. Um, let's try and find a better phrase than global health. Health is global and local, and it's the same thing we're talking about. The conclusions, the things we want to hold on to, I think I've talked about the motivation to work and learn together, and that be bi-directional, truly flowing in both ways. In previous conferences, I've acknowledged with humility how the UK has struggled with COVID. If you look at our death rates, our contribution towards that dreadful figure, Professor, of 6 million deaths globally, the UK has not done so well. There are lessons for us to be learned from other countries. And so we commit to that bi-directional learning, and we commit with humility, knowing that we can learn in high-income countries as well as share. The commitment to technology, this has been the kind of triumph in a way of this last 2 years. The world has just accelerated and our use of technology has been transformed. It's an irony in a way, but it's a wonderful thing that we can have Professor Zawe So here, we can have his colleague Thin Klein, we can meet even the context of COVID and of coup virtually, so we can keep these lines of communication going. We must embrace technology. And others have said it, including Bruce, but we embrace technology partly because we need to embrace the challenge of climate crisis. We need to change the way we live, change the way we behave. And we need to do that partly with an awareness of climate crisis. And we need to think about better preparing for the future, for the next pandemic. I had the great privilege of working alongside people living with HIV at one part of my career. Over 34 million people have died from HIV. Has the world learnt its lessons in terms of access, equitable access to vaccine or treatment? I don't think so. The world is very slow to learn the lessons, and we as health workers, as a health community, have a role to play in speaking up and talking about why health is not just a medical issue, it's a social justice issue. Turning to the event itself, I'm really pleased. We've had 25 speakers. I'm terribly grateful to the 7 global partners we've had. We've had 301 registered participants. And as you know, you can view the proceedings of the conference at your leisure. It's all being recorded, so you can come back to this, and we'll be pushing it out on social media. Please remember the digital event bag that you have. And we will write it up in a report. So we will make use of this, all that's been discussed, to create a report. This is the 3rd and final COVID partnership conference that FET will organise. But it's not the last international conference we'll organise, because it's just been wonderful to be in the company of people from around the world. As you know, some of you know, FET's traditional conference is quite UK centric, which is, appropriate, whereas this one is very deliberately more international facing, because we don't know what the world will bring next, what challenges will happen next. But we've talked about climate crisis. We talk a lot about antimicrobial stewardship. We know that there will be challenges, and those challenges need to be met together through global solidarity. So that is what the purpose of organising future meetings will be. We will work together, as the wonderful Professor Francis of Muswell said. We will work in the interests of the common good. And I want to end with the words with which we started 2 years ago in the first of the conferences, and which David Weekliam quoted just a few minutes ago. The words of Dr. Tedros at the World Health Organization, who said, "The way forward is solidarity." He said this on April the 13th, 2020. The way forward is solidarity, solidarity at the national level and solidarity at the global level. That is what we have achieved together today, and that is what I know you and we are determined to achieve going forward. Thank you so much for joining this conference, and thank you for your time. And we look forward to being in touch with you going forward.